Sound check, sound check. Hey, folks, Professor Gulliford here. You guys are doing great work in this course. This is the 1201 introduction course, and I just want to say I'm very happy to be working with you. It occurred to me that a little introduction to the respiratory care profession would be in order here, and I think would be useful. Dr. Bob Vega, our program director, may join us here in a few minutes. He's very busy getting the program completely accredited and site visit coming up here soon. So he may or may not be able to join us. But let's do this. I'm going to do a screen share sound, optimize the video. And we're going to look at the top healthcare professions, in the nation here. This is Becker's Hospital Review, and they're reporting U.S. News and World Report. U.S. News and World Report does this every year. I've been, watching this, following it for some time now. Respiratory therapy has always been high on the list, but never this high. So what caused that? Well, let me explain. Nurse practitioner, which is 7 years of training, continues at the top. If you can do 7 years of college, then that is just a great choice. There's no question about that. But for folks who don't or are not willing to, or don't want to spend 7 years in college, respiratory therapy accomplishes about the same thing in 2 years of training. Let's scroll down here. Nurse practitioner, high on the list, of course. Physician assistant, also about 6 or 7 years of training. Speech language pathologist, 7, maybe 8 years of training. Respiratory therapist, number 4, with 2 years of training. Nurse anesthesia would be about 6 or 7 years. Occupational therapist, about 7 years. It's now a doctorate to enter physical therapy or occupational therapy. Dental hygienist, 5 years of training. Psychiatrist, 14 years of training. So I'll just scroll down the list to show you the rest and help you to realize what a bargain respiratory therapy is for 2 years of training. Wow. I'm going to click on that. Now you can do this. I'll send you the link and you can look at every profession. It might be interesting for you to just kind of explore all of them. But what is respiratory therapy? Well, it's all the different problems of the heart and lungs. Today, we probably would name this profession cardiopulmonary. Yeah. Number 4, in the best healthcare jobs. Number 8 in the best STEM jobs. That's what is that? Science, technology, engineering, and math. Number 12 among all jobs. Take all jobs. Oh my gosh, there must be a couple hundred careers, and we're number 12 among all of them. We take care of asthma, chronic bronchitis, emphysema, cystic fibrosis, sleep apnea, emergency situations, heart attack, stroke. We're the go-to lung experts. And look at that salary. Wow. For 2 years of training, that's simply hard to fathom, Unemployment rate, 0.6%, which that just makes me think, well, there are 0.6% of respiratory therapists who don't want to work right now. Because if you want a job, there is a job. 16,800 jobs. So, wow, it's just one of the best, what would I say, bargains. It's a bargain in terms of the time invested, the cost of training, and the career that you get at the end of that. That's what I wanted to share with you. Let's go ahead and look at this, which is career paths. So let's say you're in the field, and you're going to make the most of your career. 75% of RTs work in hospitals. That's true. That's Mayo Foundation telling us that. But that means 25% are in all kinds of other settings: clinics, schools, telehealth, sleep lab, nursing home, DME, durable medical equipment. That's home equipment for various purposes. Various career paths: adult critical care specialist, neonatal pediatric specialist, pulmonary function technologist, sleep lab specialist, pulmonary rehab, home care therapist, research. There are lots of research jobs in respiratory therapy, mostly with pharmaceutical and equipment companies, and other career paths like management. That's what I did. I wound up being a hospital administrator. I went, on up the ladder, became a department director. The hospital paid for me to go to school, get my master's degree in healthcare administration. And I ran hospitals for about 20 years. I'm glad I did it. I'm glad I don't have to do it anymore because what I love is respiratory therapy. Neonatal pediatric transport, asthma education. We have a lot of therapists that are flying. They're flying for a living. They're on helicopters. They're on airplanes, picking up neonatal patients and transporting them to the children's hospital. Asthma educator certified, hyperbaric medicine. This is for patients with wounds that won't heal or with carbon monoxide poisoning. Representative for devices or pharmaceuticals. Telehealth. Teaching. That's what I do these days, and I've now done it for 20 years. I love it. So I can tell you that is a great career path also. So you got to pass these tests, and we are good at getting you to pass the tests. Oh my gosh, I have really made a science of helping people pass their board examinations. So I will definitely help you with that throughout your program, but also at the end when we get you ready to take the test. In-demand careers. Bureau of Labor Statistics says that we're one of the highest growing, most in-demand professions that there is. I'm just going to scroll back up here and let you see all of this. And then, of course, I'll put it in the course. But just look at all the options for careers in respiratory therapy. It only starts with earning your RRT. It only starts with that, and then can become so many other things, including up the ladder to PA, up the ladder to anesthesia, or up the ladder to become an MD. It is all possible. I hope that was useful. I'm going to post this video in the course. And unfortunately, Dr. Vega did not get to join us for this, but that's okay. We'll have him as our guest speaker another time. But for now, you have my message, which is you made a great choice coming into respiratory therapy.